Hello, my name is Vanessa Valscott, and I will be performing a sterile dressing change. At this moment, I'm going to knock on the door. I'm going to announce that I'm in the room. I'm going to wash my hands. I'm going to introduce myself to the patient, letting them know that I am the nurse that's going to be performing a sterile dressing change for their wound. I'm going to ask them, I'm going to provide privacy, and I'm going to explain to them the purpose of the sterile wound care. I'm going to ask them if they're feeling any pain at the moment on a pain scale of 0 to 10. I'm going to ask about allergies to food, latex, or medications. And I'm going to ask them if there's any cultural considerations that I should be aware of. Okay, now I'm going to wash my hands again. I'm going to check their bracelet to make sure that it matches the information that I have, such as their name, date of birth, and their customer ID number. I'm going to put on my gloves now so I can check the wound. I don't see any excess drainage. I'm going to take it off from bottom to the top. Okay, I don't see any color. I don't smell any odor. I don't see any discharge in approximation. I'm going to throw this in my red bag. I'm going to make sure that I stay below my waist. I'm going to count the sutures. The patient has 1, 2, 3, 4, 5, 6, 7. And now I'm ready for my sterile kit. I'm going to take my gloves off and put them in my red bag. Wash my hands again. I'm going to open my sterile kit away from me. I'm going to take my sterile gloves and stay within the 1-inch border so I don't contaminate my sterile field. Now I'm going to pick up my first gloves and then I'm going to put on my second gloves. Okay, I'm going to take my gauze pads, my tape, my ABD dressing, and my sterile water. They're all inside of the sterile kit, so they're still sterile. I'm going to open my sterile water. I'm going to pour it into my bowl. And now I'm going to perform the sterile dressing change. I'm going to take my first pad, dip it into the sterile water, and clean the area away from me, and throw it down. Take my next padding, dip it into sterile water, and clean to the area closer to me. Throw it down. Take my next padding, put it in sterile water, and clean down the middle, and throw it down. And I'm making sure that I'm staying below the waist area. I'm gonna take my next padding so I can dry. I'm drying the side away from me, throwing it down. Take the next padding and dry the side closer to me, and throwing it down. I don't need to do the middle. I'm gonna take my ABD padding. I'm gonna put it on top of the wound. Take off my gloves. Throw it down. Wash my hands. Put on other gloves. Now I'm going to tape down the padding. I'm going to do the first side. Going to do the second. did the top. Now with the last piece of tape, I'm gonna write the date, which is June 16, 2020, the time, and my initials. Okay. And now, this is my sterile dressing change. I'm done.